There are really a couple groups of patients that come in for breast augmentation. There are patients who just simply anatomically have not had a lot of breast tissue, and typically you'll hear, I want to fit better in the clothes that I buy. Another group of patients that are frequently seen are patients who have had children and have had some loss of breast volume after pregnancy and potentially after breastfeeding.
If you come in and you're interested in breast augmentation, first I try to get an idea of what size you want to be. Then we make some measurements and determine the best size implant for your body. We don't want to make you too big where it's going to be difficult to fit into clothing, although that is what some women want, but we want to try to make you as proportionate to the rest of your body as we can.
If they have a reasonable amount of breast tissue to begin with, then they're going to be great candidates for either saline or silicone implants. I think the silicone implants are going to be better suited for patients who have very little breast tissue to begin with, or patients who have quite thin skin in the breast. For those patients, they're really counting on the implant to impart most of the feel of the breast. And when a patient's looking for a very natural feel, the silicone implants do really impart a more natural feel than the saline implants in those cases.
Implants can be placed over the pectoral muscle or under the pectoral muscle, and that is a decision that is made prior to the operation. The most common approach is going under the muscle. There are a couple different incision approaches. We use an incision in the fold underneath the breast. There is an armpit incision, and sometimes we use an incision right around the nipple area.
Before I went to the surgery, I came for a pre-op visit. During that pre-op visit, they gave me information on what to expect, and they actually walked me through everything that I was going to experience or see, changes in my body, and what was normal and what was not normal.
You really should not consider breast augmentation to be a lifetime procedure. It is quite likely, particularly in the younger patients, that you will ultimately need a second procedure. Not everybody does, but it is very possible.
Most of the surgery performed at Piedmont Plastic Surgery and Dermatology is performed in our own certified operating facilities. That means that we've been certified by the Quad A to perform surgeries in our offices. It's the highest certification that you can get. It also means that all of the surgeons are well trained and qualified to perform these procedures in hospitals and outpatient surgery centers alike.
Surgery is serious. We certainly want our patients to be happy. We want them to be delighted with their results. But the most important thing is that we keep them safe. And we want to make sure that they understand all of the risks and all of the benefits of any procedure that they're considering.
Recovery is closely linked to whether you go over or under the muscle. Most patients go back to work in a period of about 5 days. There is some soreness that may go on for a couple weeks after the operation. Implants placed under the muscle will frequently be associated with more swelling in the upper part of the breast.
After the procedure, I get a phone call within several hours after I've been home. It's very personal, and they treat me like I'm part of their family. Piedmont Plastic Surgery has changed my life. My confidence has been restored. I'm an aging woman, and there's nothing that they can't do to help me boost my self-esteem. Anything I could possibly need from a physical standpoint, I can get right here.